Well, the epidemic of measles linked back to that Disney park in California appears to be growing. We've now learned 5 Disney employees were infected. Now a school in Southern California sent about 24 students home because they aren't vaccinated against measles and there's concern for their health. Are pockets of unvaccinated children putting everybody at risk? Here's our medical panel for today. Dr. Frank Esper is a pediatric infectious disease specialist at University Hospital's Rainbow Babies and Children's Hospital. Dr. Daria Longa is an ER doctor at Emory University Hospital and a national spokesperson for the American College of Emergency Physicians. And our Dr. Manny Alvarez, of course, is with us as well. Senior managing editor for FoxNewsHealth.com and a member of the Fox News Medical A-Team. It's great to have you all. Dr. Manny, let me start with you. The majority of people in America still vaccinate their children, so I want to point that out. But what's the risk of having, let's say, 1 or 2 children not vaccinated in a classroom or at a birthday party?
Look, the main concern is the trend that we're seeing in many communities where a lot of parents are choosing not to vaccinate their kids. And you look, at the end of the day, the measles vaccine, in order for it to be effective, the community needs to be vaccinated over 90%. When you have pockets now of dozens of children that do not get vaccinated, they put themselves at risk and they put the community at risk.
Dr. Daria, how vigilant then do parents need to be? If you have a child that you're vaccinating but maybe hasn't gone through all the measles vaccinations, what do you do if you know a family member isn't vaccinating their kids?
You're right, Janet. The problem with measles is it is so contagious. They say that the attack rate is 75 to 90%, meaning that if you're exposed to someone with measles, you have a 75 to 90% chance of getting measles yourself. So, and also measles droplets can remain in the air for hours after a person has coughed and left the room. So if your child is not fully vaccinated, meaning they've not gotten the 12-month and the 4-year vaccines for measles, you really have to keep them away from anyone who could potentially have it.
Well,
that's almost impossible to do.
Certainly is. Dr. Esper, even if we are vaccinated for measles, we could still get sick, can't we, for being around people that are carrying the disease?
Well, that's true. Understand that no vaccine is ever 100% effective. But when you vaccinate yourself, you're not only protecting yourself against getting very severe disease from measles, but you're also protecting everyone else around you. You're protecting those neighbors, those classmates, those people who may not be able to get the vaccine due to medical conditions. There's a lot of people who in the country whose immune systems, they were just not born with very good immune systems, or sometimes they're on medications like chemotherapy, or they have cancer, and they are depending on us to be vaccinated to act as a shield to prevent them from getting the disease. So it's very important for us to do that.
Dr. Esper, let me stay with you for a moment here, because I know that there are some parents, obviously 5 to 10 years, over the last 5 to 10 years, there have been a wave of parents that have decided they're not going to vaccinate their kids. Now, some of them, their children are like 5, 6, 7, 8 years old, and they're deciding, you know what, I want to go back and vaccinate my children. How long is it until those children are considered, quote unquote, safe from the disease?
You know, actually, when you get a vaccine, most times what you're trying to do is you're trying to generate antibodies. And those antibodies are what protect you from getting the disease and to prevent you from acquiring and spreading that disease. When you get a vaccine like the measles shot or any of these vaccines, usually it takes about 2 to 3 weeks before you start seeing a generation of protection. So if you get vaccinated now, your protection will be within a month or so.
Interesting. Okay, I have a kind of a broader, more philosophical question, if you will, for all of you doctors, because as I mentioned, most Americans are vaccinating their kids, and that's the portion of Americans I want to talk to as our viewers out there, because the majority of our viewers probably have their children vaccinated. There is a question, and Dr. Manny, I'll start with you on this, about personal liberty and having the choice to make the choices for your children, and also what's good for the community if your child is going to public parks and public schools. And I'm wondering, Dr. Manny, because states have different regulations for giving parents waivers, should there be a federal regulation for parents to say that if your kid is in public areas, they have to have certain vaccinations because of the returns of diseases like measles? What do you think about that?
Well, look, I think that vaccines have prevented millions of children around the planet from dying, and that's a basic scientific fact. If we get into the argument, a philosophical argument whether vaccines are safe or not, they are safe. I think, for parents not to vaccinate their children is basically they're putting their children at risk for something major happening. So the fundamental is, I think that if this is the trend that many communities are going to have for opting out because they have some weird belief, and I say weird because it is weird to me, that they're not going to protect their children, then maybe we need a federal mandate.
Dr. Daria, what do you think?
You know, Jenna, as an ER doctor, I see children come in with many illnesses, many of which can be prevented. The problem with measles is that it is so dangerous. People don't realize that often, and it is so contagious. So this goes from being just a personal decision to really a public hazard if you're not vaccinating your child.
Dr. Esper?
You know, I would say that if you actually look at the past, when you talk about the things like when we began with the smallpox vaccinations, there were federal mandates regarding some of the early uses of vaccines. However, the law has evolved over time, and now it's more of a state-run issue. I certainly believe that if we continue to see the trends that we are seeing right now with measles as well as whooping cough, some of these vaccine-preventable diseases, we will need something from the top down to make sure that everyone stays vaccinated. But it really starts with education and good discussion between yourself and the pediatrician.
And Dr. Manny, what questions should parents be asking them? And then if they're going into a school year, should parents be asking about other kids in the class that are not vaccinated? Are they even going to have access to that information to know if their children are at risk?
Well, unfortunately, because of public records not being available, especially when you're talking about what kid is sick in your school, you're not going to get that information. It's very unfortunate, and parents don't get that information because schools do not disclose what kids went home with the measles or so on and so forth. So you're kind of sort of left in the dark, I think. But every community, every PTA and things like that should at least give some ideas of some of the problems they're having in their local school systems.
Dr. Manny, Dr. Daria, Dr. Esper, it's great to have you all. I have to bring my little boy in for vaccines this Friday. I know it's hard for parents. It's hard for me to watch those shots, for sure. It's really tough.
It is.
But you want to do what's good for your children, so try the best you can. I know for all parents out there, we're all trying to do the best we can. Thank you so much for the time today. Appreciate it.
Thank you.
Thank you. Take care.